guy's going to crumble. He hasn't got the chops. And he thinks he has got the chops, which makes it 10 times worse.
We should send a statement instead.
No. That would look appalling. We absolutely need a body in there.
Oh, yeah, no, he needs to do it. He should do it. I want him to do it. I'm going to ring around and get everybody to Sky Plus. I want to put the thing on fucking YouTube.
OK, well, great.
A 7-day NHS issue. We got to the fact that it's all included somehow in the 10 billion. Ballpark, how much of that 10 billion is needed for the 7-day NHS?
We haven't separated it out in that way because part of...
Yes. Right, here we go.
So, for example, if you didn't do the 7-day contracts that are potentially being imposed, I'm just interested in how much you think you would save by not doing it. You must have an idea of what the number would be.
So can I just be clear, in terms of the junior doctors' contracts that you're talking about, that we're...
I suppose it's not just junior doctors, is it? No, OK.
Well, for the junior doctors' contracts, we're not changing the overall envelope of pay, or the amount we pay for junior doctors in terms of those contracts.
No, but if they're working more weekends, presumably there's somebody else who's having to cover, if you've got the same number of doctors, shifts and rotas and rosters that they're not doing in the week.
Well, so it's important to look at the whole of the contractual environment in terms of thinking about that. Clearly,
it doesn't look particularly relaxed, does it?
There's a lot of attention over the last few months around.
I don't want to spend too long on it, but I just wanted to understand. You said the 10 billion covers the 7-day NHS. I just wanted to know when you've told me. I think the answer.
Yes, it is.
There isn't a. But you don't know how much of it
there is no separate pot that we've set aside for something with the specific label. That
doesn't give a great feeling of warmth that you understand the implications of the policy.
He's like a chicken. He's like an enormous chicken.
I wish it was a question that could be answered in a simple way, in a mechanical way that applied to every single trust and local health economy.
Right. But if you don't know that answer for the whole NHS approximately, I understand you have to work it through in detail, but if you don't know in broad terms what that answer is, I mean, how can you be doing the policy?
Well, it differs so substantially from one local health economy to another. When we've looked at some of the aid doctors...
Looks like he might be about to shit himself. Is he going to shit himself?
I don't make an apology for saying that there isn't a simple answer.
Sweaty top lip.
That is a sweaty top lip.
I mean, you could solve a drought with that.
I'm just kind of surprised that you can put this policy into place without having some idea of the implication for staffing levels at the headcount planning level, which is what today's hearing's about, or indeed cost and budget.
So that's a big part of the reason why the planning guidance in December asked local footprints to create their own sustainable transformation plans that brought...
What the fuck is he talking about?
And in this report, I think it talks about 9% nurses and doctors average leaving every year.
This has got to be the worst fucking ever. Is this a snuff movie or what?
Because obviously the one thing that we could all agree on is that the cheapest and best way of doing manpower planning is keeping valuable people that you already have. I mean, in terms of the four of you, which of you are accountable?
What's he doing with his eyes?
The agency question is a very challenging one for us.
Challenging, okay.
Oh my God. He's got a nervous blink.
That's a mega blink. It's not just a blink.
He looks like what happens when you punch a cow.
Well, I'm not sure that...
It's just one word he's been saying, which is basically...
temporary
But
staff.
being direct, you're unlikely to make... I mean, the government heralded £1 billion worth of savings from these measures. You're not going to make £1 billion, are you?
Oh my God, this is like watching a lion rape a sheep, but in a bad way.
Everyone knows this is an important issue. Are you saying that when you commissioned this review, you didn't specifically mention it and say, make sure you look at this?
What they're doing is like a meta-review, so they look at all the pieces of research that have been published.
What does meta-review mean in English?
Meta-review
Most of us don't speak Greek.
Okay.
The cameramen are laughing.
There is no readily accessible data on vacancy rate. There's limited data on course completion rates. There's limited data on leaver rates, and there's no inclusion of information on staff employed by agency for temporary staff. So you don't know, do you?
So the report rightly identifies that there are some data gaps within our workforce planning.
That's generous.
I wouldn't disagree with that. That isn't to say there isn't action that we're taking across the system to fill those data gaps. We have workforce information architecture process where...
I'm going to phone in a fucking bomb scare.
So the lack of data, as Karen Smith has rightly highlighted, really worried us before the hearing, and I'm not sure that we're convinced by the answers that that you can do your job without that data.
One of the themes of the conversation this afternoon has been that this is both a question of judgment as well as one of scientific fact. And
this is like watching Bambi's mother being punched by John Leslie.
So if we're trying to guess what might have made it go out of sync over the last few years, do you not think the main change factor has been the continuing efficiency programme pressing down on the budget levels available to them? Is there anything else?
I think an unrealistic efficiency expectation last year was a factor.
Thank you.
It's been building over the last few years, and the deficit increased over time. I think probably last year, maybe the year before, it probably tipped and got to the point where it was out of control.
Yeah, I'd be thrilled, I'm sure. His department on the rack, you'd be like, hey, Holly, thanks for running the department, although it seems to have all turned to shit.
Piece of information, I've just had a news text here that says the BMA have announced further 3 days for industrial action. How is the 7-day service going to work in light of this, especially with junior doctors leaving?
Well, obviously that news has come in since we've been sat here today.
Pull it, puncture his life belt. Pull it, give him the signal.
Given you've acknowledged you don't have the data, and you freely acknowledge that, it is interesting that the Secretary of State and the department went out and imposed a contract on junior doctors when there are real gaps in your long-term planning for staffing.
Well,
seems like you're flying blind.
Well, we believe that the contract that we are imposing is a...
You don't deserve to live.
Get him properly fucking screen tested. I'm sorry, mate, but you need a lot of powder. I've never seen anybody look so fucking ugly with just one head.
Yeah, no, I lost my islands of safety, didn't I? Which is...
And who was it that did your media training? Myra Hindley. I mean, it was terrible. All this hands were all over the place. You were like a sweaty octopus trying to unhook a bra.